everybody. This is Dr. Roya, and this is our fifth program. This one is about reflux and also inflammatory diseases are of various kinds. If you ever hear that you have been having an inflammatory condition, then this does help, this kind of diet. So for reflux, first of all, usually people would have acidity, or it's usually in the mid chest area or upper stomach area. And sometimes they feel like acid is coming up. Sometimes they feel bloated. People are, complaining of bloating, or it can be a feeling of indigestion, like a heaviness in the stomach after they eat food and all, or they feel that they're not digesting food properly. Sometimes people can have cough, like they would cough as a result of the acidity. And so they are told that they have acidity and they have got to take some medication for that. Now, you could do all of those medications, whatever your doctor prescribes for you. Sometimes the pain can be really, really bad. So you could have pain after eating or before eating, mainly with the things which are acidic or caffeinated. So with coffee, tea, sometimes walnuts, and any of the pop drinks like that or alcohol, they'll feel they have really bad pain. Sometimes it gets severe enough that in the middle of the night, people wake up with that. Usually the cause is not just the acidity in the stomach. There can be many other causes. Stress can cause this. I've seen this in children who have got like exams and stuff like that, or the young students who are going to university and they have exams and they come with these kind of problems. So that is also one of the diseases of stressed mind. So for those things, for the stress, of course, you could go to the psychiatry part of my discussions and treat the actual cause, because that's also an important thing. Meditation, especially, and all the homeworks for people who are stressed out, who have anxiety or they have depression, that also helps. That's another way of doing things. But then today we're going to concentrate on the diet part of it, because there are things that you can do with diet. You are what you eat generally. So this is going to be taken care if you change your diet a little bit, and that would help you out. Normally, it takes about 6 weeks to heal completely, but you can feel better within the first couple of weeks. And I've had patients who have completely like refused to have medication, and I give them these diet, and they actually come and tell me that within 2 weeks that they're perfectly fine because they just follow the diet. Now, the things which are inflammatory and causes more acid formation, number one is alcohol. So if you're drinking alcohol, then that's something you have to put aside for a while, at least 2 to 6 weeks. You have got to heal it. Remember, in reflux, what happens is that you have kind of a scratch within your stomach. And that scratch, it's like a scratch outside. Like if you have a cut or something or your hand and you put salt on it, it's going to hurt. So you got to stop adding things which is going to hurt the scratch inside of your stomach. I also have to tell you before we start with the diet that if you have any severe pain in your what we call epigastrium or upper stomach or middle of the chest, or you wake up in the middle of the night with that chest pain, then you should go see a doctor, definitely, or emergency. But we're talking about the normal cases where the pain is there, but it's not so severe. So alcohol is your number one. And if you're a smoker, smoking is another kind of thing that adds to the problem. So you've got to stop both of them. It's hard to stop smoking, so I would say just reduce it as much as you can. Make sure it happens after food and not before food, because it makes it worse. So those are the common things that I usually suggest to my patient, do that. Then the spices. Spices are really important if you have a lot of hot food, peppers and different kind of peppers, then you got to avoid those ones. And also the processed food or juice. These things also cause a lot of acidity. So does caffeine. Caffeine are found in chocolate, in energy drinks, in pop, and in tea and coffee. So you need to avoid those ones, or else I tell some people get decaffeinated coffee or tea for a while. And also, what you could do is use a little bit of baking soda in it. That would really help actually to reduce the acidity, and it would make you feel better a little bit. But in general, if you avoid the things which trigger it, then you allow it to heal. Once it's healed, then you can go back to those things, but in moderation. Then large amount of food is always a killer. So I would definitely reduce the amount of food. It doesn't matter what kind of food you eat, but if you make it less amount of food and you chew it really well, it helps. Then the other things that are very common are tomato, seeds, and cashew. There are two things which are high in acid formation and causing inflammation, and those are the things that you want to avoid. Then there are cow products. So in general, I tell my patients to avoid cow products at least for 2 to 6 weeks. You can have goat, you can have sheep, you can have other kind of milk or milk products which are not from cow, or like yogurt and other things, cheeses especially. Uh, you can also have things like oat and soya and all. Only men are the people I tell them to avoid soya because it's got a lot of estrogen and you don't want that. But you can use any other thing from almond milk to oat milk to any other kind of things. Now, if you have to have cow product, then I would go for lactose free, and that helps as well. Uh, all these things that I'm telling you, it's all part of Ayurvedic medicine. So it does help. It doesn't mean that you shouldn't be going and seeking help. It just means that if you have some of these things and if you are taking medication, if you do these things, that would help you to not have to take those medications more often. Then there are um, the cow meat, which is beef or veal. Both of them also would cause this matter to get worse. Processed food, especially processed meat, are really big in that. Processed cheese, all of those things. The more smaller portions they are packed, then they are more processed. When you get bigger packages, they're less processed. But processed food are anything which is usually you can keep them for a long time, like in the morning cereals. These are all processed. White anything like white bread or white sugar, they are way more processed than the brown ones. So that would help if you go more for the brown stuff. In rice, it's not so much different in terms of acidity, but it's up to you what you're going to do with that. Then, as I mentioned before, stress is something that you have to take care of. And those are the kind of things that you want to make sure that you have discussed and have taken care of. Of the nuts, walnut is really associated with high acidity. So that's one of the nuts I would suggest that you cut back during this time. The rest of the things, you can have them. But if you do this for 2 to 6 weeks, you will see a reduction in the amount of medication that you have to take for that. And if you do it on a long-term basis and not eat after 5 to 7 p.m., maximum 7 p.m., but generally I tell people 5 p.m., it will allow your body to rest and actually get better and heal better. So I hope this helps you. If you have any questions, you're welcome to contact us, and then I would respond to your questions. I hope that this helps you and it can make your life a little bit easier. Take care and have a wonderful day.